Alright, so we stopped in part 1, we stopped on external documents, where I explained that any external documents that are brought in by the patient will be scanned into the documents by the therapist. The diagnosis will be entered in here, and for this space, what you have to do is enter the diagnosis and enter all the staging information. Once you enter the staging information, you will have the patient fully staged like this. The staging is incomplete when you don't enter it. And I'm going to just demonstrate a quick. So what we use here is the staging codes. And what you have to do is come to this code tab and click on it. And you have to make sure that it's either, if you know the code, you can enter it directly. So for example, I can type in C61, for example, and it will take me straight to prostate CA because I know the code for prostate cancer. But otherwise, you can come to keywords and you can type prostate, for example, and it will show you all the codes for prostate. Something else to note is that if you want to use only the cancer codes, you should select this tab, cancer codes only. Otherwise, you'll get a lot of benign conditions showing up, calculus of the prostate, inflammatory disease of the prostate, and so on and so forth. But if you want the cancer codes, click this, and then it sort of narrows it down for you to specifically what you're looking for. And in this case, we want a malignant neoplasm of the prostate, and I can select OK, and it will populate that. But I want to use breast just because that's a little more complicated. So this is breast, and again the cancer codes start with C, and you will see unspecified, overlapping, axillary tail, outer quadrant, upper lower, inner quadrant, upper lower, central portion. So we're just going to choose inner quadrant, for example, here, and select OK. Now the clinical description is how you would say it if you were writing it in a case file or you were having a conversation. So you're not going to say, Dr. Joseph, this patient has malignant neoplasm of the upper neo. So you would probably say breast cancer. In fact, you would say left breast cancer, for example, left breast cancer. You can now say upper inner quadrant if you wanted. So this is the clinical description, and this is just the shorthand between physicians, how we talk to each other. You can now add other details. For example, you can say this patient is treatment naive, and you can say she's in her 3rd trimester. You know, if you wanted to just add something else that is pertinent to the case. The status is active because this diagnosis is still active. If it wasn't, you could change it to control, to cured, in remission, and cold. But this patient is active, so that is it. Diagnosis method is how you've made this diagnosis. It will usually be by histology or pathology. Other ways are imaging, tumor markers, ultrasound, and cold. But usually this is what you're going to be selecting, and it is a primary tumor. Something important, and why I wanted to use breast, is to remember to specify the laterality. If it is a right side tumor, you select right side. Left side, you select left side. This will help us make our data, our records more. For example, we'll be able to say, do we see more left side cancers or right side cancers in the breast, in breast cancer? So these ones, I will show what they are useful for shortly. So we've selected our definition. This patient has breast cancer on the left upper inner quadrant. Then we go to pathology. Here again, we select this and you look for the cell category. Ductal carcinoma is the most common, so I'm going to select this, and then you can go down to the cell type. So you can have duct carcinoma, not otherwise specified. It can be adenocarcinoma, infiltrating duct adenocarcinoma. You just have to be as specific as possible in selecting that. And then the grade from the pathology report you would have, if it's a grade 1, grade 2, or co, you select that as well. If for any reason you come here and you can't find what you're looking for, you can use the search button to search for it. So I can come here and type doctor, or I can type invasive ductal carcinoma. Let's correct that. And search, and I get nothing because it will be recorded as, in fact, let me delete all of this and just leave it as ductal carcinoma, and let's search, and then you see the different types. So you select ductal carcinoma here and OK, and then you can still select the grade down here. These other things are from the pathology report. The tumor size, if you have it, put it there. The margins, if they're positive or negative, this is very important for us to enter that information, and so on and so forth. So if the patient has DCIS, they can say DCIS was present but not otherwise specified. You can do that. Or you can just say it was minimal, moderate, extensive, depending on what is in the report. Or you can say it was not present if they specifically said it's not present. But if the pathology report didn't mention it at all, what you should select is not mentioned. The fact that it wasn't mentioned does not mean that it's not present. It just wasn't mentioned. And it goes the same for everything all the way down. If they did an axillary dissection, you should document how many nodes were taken in total. So they removed 14 nodes in total. And of those 14 nodes, 9 nodes were positive. If they tested cytokeratin positivity, you report that. And if we have the node sizes, you can report that. If there's extracapsular extension in the nodes, you can also document that. It can be present, not otherwise specified. Or you can, if the pathology report was more detailed, you can select focal, extensive, not mentioned, etc. The immunohistochemistry status, same thing. Negative, positive, unknown. So all of this is information that we should put in the report. KI67 we often don't have in our environment, so you should put that as unknown. And we also don't usually have oncotype DX. But I will explain why this is important later. So for the pathology, we just go through all of these sections and try to enter as much of the information as possible, so that we have as detailed information as possible. Then we come to staging. We're going to skip lesion for now because we don't report that. We'll come to staging. So in the staging, the first thing is to decide what type of staging you're doing. Are you doing pathology staging that you do after surgery, after mastectomy, for example? Or is it clinical staging that is based on clinical exam and imaging and testing? If we're doing pathologic staging, okay, no, let's use clinical. No, let's use pathology. If we're doing pathologic staging, for example, so we have the tumor size. They've given us the tumor size based from the report, so we know it's a T2 or T3 tumor. We know that they excised 14 nodes and 9 of those nodes were positive. Okay, and this, what you have here is 4 to 9 axillary lymph nodes, 4 to 9 metastasis in 4 to 9 axillary lymph nodes or positive ipsilateral internal mammary. Metastasis in 4 to 9 axillary lymph nodes, at least one tumor deposit larger than 2 millimeters. So depending on how detailed the pathology report is, again, you can select, your nodal status here. So we had said that she had 9 axillary nodes, and so we're going to do this. We know that she doesn't have any metastasis based on imaging, and we're going to select MO. The grade, as we discussed earlier, I think we selected a grade 3 for her, so we'll put that as a grade 3. HER2 status, she's HER2 negative, she's estrogen receptor positive, PR positive, and then once you haven't entered all of this, you're still going to be seeing it as a stage X because you haven't completed the information, so the system is not going to stage it for you. However, if you come here and just select oncotype score not evaluated, then the computer is going to give you a stage. So until you enter all of the information, and for each one of these information, you will have the option to select positive, negative, or not evaluated. Once you do that, you'll be able to have a proper stage for this patient. So we finished the staging, and I'm going to select OK. So now we have her diagnosis. This is the one we did. We have left breast cancer stage 2B and co. We can now add a new diagnosis. So if this patient has metastasis from this breast cancer, for example, let's say she has liver metastasis, I'm going to come here and type liver into keywords. And again, I'm looking for cancer codes only. If I remove cancer codes only, I'm going to get all of this. So I'm going to type cancer codes only because this is metastasis. And I'm looking for secondary malignant neoplasm of the liver right here. And I select that and I select OK. So again, clinical description, I'm going to write liver mets here because she has liver mets. The status is active. I can now say liver mets. I can say maybe You might want to describe, you might want to add if it's synchronous or metachronous, depending on when she had it. Or in this case, if we're not, this is breast, so we might want to say this is a recurrence, but there'll be a space to enter that. You might just want to put some more information in the clinical description. Again, the status is active. The diagnostic method here is going to usually be radiology. So we might want to say it was diagnosed on CT scan, or maybe a liver biopsy if possible. You might want to put that, and you might want to say image guided liver biopsy to give more information on the method. Laterality is not going to be useful here, but the important thing here is that we then come here to select the primary site. We've entered the diagnosis of breast cancer before, so just to show you again, this box is where the primary disease will be entered. But if you have not entered the primary disease as a diagnosis on its own and saved it, you won't be able to do this. So you have to then come here, select the primary diagnosis, which is left breast cancer, select OK. And here it is now going to attach this secondary liver metastasis to the primary left breast cancer. You will want to say this is liver metastasis, and you want to say this is distant metastasis, and you want to say it is recurrence if it is a recurrence, or you want to say no, it is not a recurrence, she presented ab initio with, or it's progression, and select OK. So that will then give you the two different, the left breast cancer that we entered and the liver metastasis that we entered. So there'll be more sessions on entering diagnosis. Diagnosis is usually the most detailed part of the EMR, but this is just a basic tutorial to show you how to get around that place. And then there's medical history. So medical history is just past medical history, and you're going to go through medical problems. So the patient has cardiovascular disease, you select that. Is he on treatment? If he's on treatment, you select this column to show that he's on treatment. You use this calendar to indicate when it started. So she was diagnosed with it, for example, in 2015 July, and if you don't have the date, just put the first of the month, and if you don't even have the month, just put the beginning of the year. So if we know that it was 2015, then we'll put January 2015 and we'll put it as 1st of January 2015. And we'll save that. So we know she has cardiovascular disease. If she's had any surgical procedures before, we'll select it. So she's had a gallbladder surgery. Again, we'll come here and select the date when she had the gallbladder surgery, June 2020, and select 1st of the month if you don't have the specific day. And what that will do is show you the age at which she had it. So she was 52 years old when she had gallbladder surgery. You will do family history, and the most important thing here is cancer. You want to take note of other things, but clearly cancer is the most important. And if there's no remarkable family history, we can remove all of this, and what you will come here is select no remarkable family history. We can't do that in this case because we've already selected other things here. So but you put the family history, and you can be as specific as possible. If it was in the father, you select the father. You put the age that the father was when he had it. You can enter that here. You can enter a short description to whatever, just to say, this is what he had. You can say if he's alive or dead. You can say the age at which the father died, and you can put all that information there. Finally, we'll come to smoking. So this patient has never smoked and never had alcohol, and you select those two. If she has, you come here. So smoking, yes, current everyday smoker, you put that there, and you put how many years she has been smoking. So we can again come here and say she's been smoking since 2014. Again, 1st of January, and it will show you immediately that she's been smoking for 8 years. And she smokes 3 packs a day, and it will calculate for you the pack years. If the patient has been smoking but has quit, again, you can select the date that the patient quit smoking by coming here and going back in time to say she quit smoking in June 2021, and again to show you when she quit smoking, to show you right there. So that's the smoking history. And finally, you can add some comments here to say, you can add any comments you want. You can add, so to add a comment, you come and select on new, and you can say, for example, very anxious about time away from young children. Although that's more something that will be in the journal. So let's put something here that is more medical history. So we can say something like possible penicillin allergy. So she's not sure, but we can put it in here. It's possible. And category, again, you say what it is. Is it general? Is it financial? Pharmacy? Lab? Privacy issue? Whatever. So this is a general comment. And it is high priority if there's a suspicion of an allergy, and select OK. And all of that information is going to populate for you here. Anytime you come to medical history, you click on it, all the things that we have said will show up, and you will find even the comment here. Allergies is a very simple thing. Again, you select new or edit, and they've selected allergy to amala here. So you can edit this, food, allergy, amala, or photosensitivity. So we can select new, allergy type, again food, and then we can say she's allergic to beans, for example, and you can say OK to that, and it will show up as allergy to beans. We can also add something that's not necessarily in the list and say that the allergy type is a drug or is unknown, other, and say maybe grass, allergic to grass. And what this part does is that it shows you how does she respond. So whenever her skin touches grass, she breaks out in hives, and I select OK, and it will show me that whenever her skin comes in contact with grass, she breaks out in hives all over her body. So this is allergies. Vital signs will be entered at nursing, but what we want to do here is, monitor the vital signs and pay attention to the graph. Now with this graph, you need to edit the dates. So let's edit the date of this graph. No, so this date is not. So if you edit the date here, you'll be able to see your patient's vital signs and how they've progressed over time. Infection control is used when you have infections that you want to take note of. For example, tuberculosis. You might want to pay attention to that. Select OK and save it there so that somebody else who comes will know that the patient has tuberculosis. Status icons are used for important things that we want to take note of, or just to say that there's another patient who has a similar name, so you can select same name alert here. You can also select that this patient is signed up for Nlcc ambulance service here. So we have to edit this. Actually, we have to select edit. So I'm going to turn off referral. I'm going to leave on same name alert. I'm going to turn on concurrent chemoradiation and ambulance. And if I click OK, if I come to the top right hand corner of the screen, you will see that has same name alert is on chemotherapy and radiotherapy at the same time, and is signed up for our ambulance service in the center. The other parts are parts that any physician is comfortable with. You know how to enter chief complaints and history of presenting complaints, how to do physical exam, review of systems, creating an impression and a plan, and then radiotherapy prescription, which the consultant oncologist will do. The journal is where you will find documentation about chemotherapy cycles that the patient is on. Current medications will be here, and you can use this space to order drugs. And there are other things you can order as well. You can order tests at the end of the encounter. You can order a CT scan at the end of the encounter. You can book a follow-up visit. And these are just other checks in place for us as reminders to make sure that we've checked this patient's renal function. We've done a pregnancy test if it's a young woman. We've done an oncofertility counseling, and we've done a psycho-oncology check. If we need to refer this patient to psycho-oncology, we've checked the distress thermometer and assessed whether this patient needs extra psycho-oncology attention or not. So that is the summary of the encounter workspace, and I'm going to save that. And we're done with this patient, so I've saved this encounter, and now I'm going to go back to the home page.